Good morning. Thank you for joining us today for Maximizing the Environment for Individuals with Dementia. My name is Jennifer Cardellini. I'm the Director for Consumer Information at Benjamin Rose Institute on Aging and the Co-Project Director for the Administration for Community Living Alzheimer's Disease Programs Initiative project, expansion of dementia-capable communities within urban and rural settings in Ohio using evidence-based and informed programming. This session today is being offered as a part of this Administration for Community Living project. Today's webinar will be recorded. During the webinar, you may submit a question at any time using the control panel on the right-hand side of your screen. We have staff monitoring the questions box to convey your questions to our presenter and to answer any technical questions you may have. We are conducting an evaluation of our dementia education sessions as a part of this project. You should have received an email with a link to the pre-session evaluation questionnaire, which also contains further information about the evaluation. If you did not have a chance to complete the pre-session questionnaire, we ask that you please complete this now using the link provided in the chat. By doing so, you are helping others in your community. Your responses and feedback will be used to show the impact of programs like these and to improve the tools and resources provided to individuals living with dementia and the people who support them. I now have the pleasure of introducing our keynote presenter for this morning's presentation, Dr. BUDDELMEYER. Dr. BUDDELMEYER is an associate professor in the Occupational Therapy Department at the University of Findlay and treats patients with dementia. He has been published and provided numerous presentations at the local, state, and national level with regards to best practices for patients and families facing Alzheimer's disease and dementia. Please join me in welcoming Dr. BUDDELMEYER.
Good morning, everyone. Thank you so much for taking the time out of your schedule today to join us for this presentation. I'm always excited to speak to a topic that I'm so passionate about, and I hope that I'm able to educate you on some important concepts this morning. So we're going to go ahead and get right to it. So my objectives here for you today are listed, and that is to share information surrounding falls and the dementia community. We're going to talk a little bit about physiological and environmental barriers to consider in the home. We're going to talk about occupational therapy in the home and what I do as an OT in regards to safety in the home. And I'm going to talk to you about some case examples that I have worked through in my time as a practitioner, and hopefully give you some perspectives on different environments and how to support people with dementia. And I'm going to also provide specific examples of adaptations that can be made to better support community safety and mobility. So today, what I want to encourage you to do is to think about your own personal space and your environment and where you interact with someone with dementia. While many of the examples that I share will involve the home environment, many and most can be transferred over into other environments such as businesses and community environments. So I hope that you can see and make that distinction and that connection. So I always like to start my presentation talking just briefly about what an occupational therapist is and what we do. So one important concept to think about is how we use the term occupations. Occupations are everyday life activities from the time that you wake up until the time that you go to bed that are meaningful and valuable to you. And what I want to do as an OT is to help to support and promote those engagement in daily occupations. And so dementia is one example of a chronic condition that I work with people to help to promote where they're at so they can still do the things that they need to do and that they love to do in a day's time. So oftentimes I will explain to my caregivers, I really try to be that bridge between what is and what is not working. And one of my favorite areas of practice is actually in the home and community-based practice, because I'm really able to get an intimate look into the person's environment more than I could ever begin to understand in a doctor's office or in a clinic. And that allows me to kind of really understand what's going on. I also use evidence and research to help inform my decision making, which is really important as a clinician. And OTs can actually work with people from birth to death. So my specialty area has been for quite some time to work with people with dementia. And you'll hear me use the language, people with memory challenges. It's something that I feel like is a softer language to use and encompasses people with cognitive deficits such as dementia or Alzheimer's disease. So you will hear me use that language in today's presentation. So to start off, I want you to consider being confined to your home because you cannot safely enter and exit your home. How would this impact your mood, feelings of isolation, and overall quality of life? So this is actually happening in a lot of different spaces when older adults or people with dementia feel like they cannot safely exit their home because their steps are not sturdy. There are no longer handrails outside that they feel comfortable holding on to. Also thinking about, as a primary caregiver, you know, if you were caring for your wife who was in the moderate stages of dementia, taking 4 hours to get her ready to bathe, to then bathe her, then get her dressed, and then get her bathroom cleaned up. And you also have chronic low back pain, which makes it even more difficult to physically do these things for her. It would have an impact on you for sure. So I want to dive right in. This is one of my favorite pictures of a case that I worked with. And I have permission from all of the cases that I'm going to share with today from the patients and families that I've worked with to share their stories. So this is Eileen and Charles Strasbaugh. And with this slide, I hope to highlight to you the relevance and the importance of the caregiver and how there is an interdependent role of the person with dementia and their caregiver. And to start off, I want you to think about, and I want you to close your eyes if you can, and think about who your person is, the one that makes you feel happy, the one that makes you feel fulfilled. When you're happy, when they're happy, you're happy. And when they're struggling or when they're unhappy, you can feel that, and there's a weight to that. And I want you to open your eyes now and think about that person if they had memory challenges. And this is what I want to bring to light to you with this case. Eileen and Charles were married over 55 years. He was her primary caregiver. And I'm going to take you through a little bit of their journey. But I never enter a case without thinking of both parties. And as we talk about the role of home safety and assessment, it is not just that of the person with dementia, it's the caregiver. And I feel very strongly about that because they both have a pivotal role to help support the ability to age in place. And people with memory challenges deserve that same right as any elder in any community. So we're going to hopefully talk about ways that we can do that today and remember the key role that these caregivers have. And home mods are one way that we can do that. So to share some demographic information here, this might surprise you, maybe not, but 1 in 3 visits to the emergency room is actually due to a fall. Older adults in general are at an increased risk of falling, and people with dementia are even higher. And for every emergency room visit, that's usually around $2,000. And there's also an average stay of 4 days in the hospital. So as an OT, I am really focused on trying to prevent these hospital admissions in any way that I can. And home safety and assessment is one area that can really help to do that. After a fall, someone can experience a loss of independence. There's definitely a family strain. And there's decreased quality of life, which we try to preserve as much as we can. And many people who do fall become afraid of falling, and sometimes they don't even disclose this. And when someone has memory challenges, they can't necessarily articulate that they're afraid to fall, but they show us behaviors where there is a resistance to bathe, or there is a fear of going into the living room from the kitchen. There are just these tendencies that we can start to see when people begin to experience falls. And another statistics that I want to share with you is that people with dementia are hospitalized 2 to 4 times the rate of same-aged peers without dementia. Certain conditions contribute to falling, dementia being one of those. And it's that lower body weakness, difficulty with walking and balance, and those visual problems that become a hazard to someone with memory challenges. And OTs can help to identify and address those concerns, like I had mentioned, before that fall happens. So for individuals with dementia, we need to think about the physical and the cognitive limitation in terms of the home environment. So I want to go briefly into visual perceptual abilities, because this is something that I feel like doesn't get enough attention when we think about someone with memory challenges. So, you know, visual perception is more of an umbrella term that's used to describe a range of visual processing and visual perceptual skills. Quite frankly, it's something that we get up every day, and if things are going well and we don't have an impairment, we just take it for granted because our bodies and brains and minds and it just does what we need to do. So this is something that really declines or can become challenging for someone with memory challenges. So if you look at these images on the screen here, you know, reaching into a silverware drawer, there's a lot going on in that drawer on the left. And usually, if there's not a deficit, we can kind of differentiate. We can see a spoon from a fork, from a knife, and we can figure that out. When someone has memory challenges, this becomes much more difficult to differentiate common object items, such as the slide that I'm showing you on the left. On the right-hand side, you can see a long hallway. You can also see that there's hardwood floor and there's a throw rug in the middle. This can be a challenge for someone, again, to differentiate between hardwood and a throw rug as they're ambulating down the hallway. I really like this table because this points out I've highlighted just the dementia component here and the area of deficit that someone with memory challenges experiences, which is depth perception, pattern recognition, and being able to identify contrast. So what does that mean in terms of daily function? This is the important piece here to think about. When someone has memory challenges, they're going to have more difficulty navigating steps, curbs, identifying cracks in the pavement, and then also avoiding common obstacles in the home, which can create unsafe space in the environment. In this image, you can see how, you know, it kind of just all washes together. There's a white plate, white rice, a piece of white bread. So you can imagine, based on what I just shared with you, if someone with memory challenges sits down to eat a meal and this is what you present them with, they're really not going to know the differences that are on the plate, let alone if you're putting a white plate on top of a white tablecloth. It makes it more difficult for them, compared to thinking about contrast and how these bright plates that you'll see, the blue and the red, and how that can really just pop for someone and kind of bring their attention to what is in front of them. And this is kind of a cute little life hack that I've recommended for my caregivers: to go to the dollar store, purchase some colored plasticware to use, and it has made an incredible difference for many cases that I have worked with through the years. Again, because that person with dementia was struggling to see the food, so they weren't eating as well, or struggling to see their medications because they were being placed in front of them on a white tablecloth, and maybe the medication was a white pill, where this contrast can really help to pop for people and let them kind of process what is in their visual field. Also thinking about the home environment here and navigating this. On the left, you can see this stair step down. And, you know, while this may be a more contemporary picture, you know, look at the white walls with the white steps just kind of going around and down, and how difficult that would be for someone with visual perceptual deficits. And then also looking on the right side, you know, being able, as an OT, I have to look at the environment and see, okay, what is there and what is missing to help to support my person with memory challenges to navigate their environment safely. And what I can tell you is when I look at this picture, and both of these really, the stairs are narrow, there's white on white, so there's no hard line to differentiate the end of the step. There's no railing to hold on to, and that's a lot to ask of someone with memory challenges to navigate up and down safely. Compared to thinking about this example that I'm showing you here, where you can see that hard edge line in yellow and black, and on the right side there is a rail there that someone could hold on to. So that contrast and that railing can really help to make all of the difference. So I do want to go into two primary reasons that people fall, and one is physiological. So naturally with aging, there's a decrease in both strength and balance. Again, these are exacerbated with someone with memory challenges. And then also the physical environment, and thinking about how impactful our environment can be, whether we are able to safely and independently thrive and function in our environment. So those are the things that I'm kind of looking at as I get to know my individual with dementia. So I want to go into physiological and environmental here on the next couple of slides to get you kind of thinking about these things and how they can increase those risk for falls that we see. Obviously, having memory challenges puts us in that category of higher risk, alongside a decrease in strength, balance, and gait. Sometimes medication can play a role in that, switching meds, increasing medications, or dosage, I should say. Arthritis can also play a role. If someone is diabetic, sometimes people will experience distal neuropathy, where there's that numbness and tingling in our hands and feet, and that can play a part in an increased risk of falling. We've already talked about visual challenges, which would fall under this category, incontinence, and then overall if there's diminished sensation. Next, moving into environmental, and we're going to dive a little deeper in the next several slides down here with regard to environment. But thinking about what I'm showing you here in these images and all those boxes there on the top, again, this is something that I can really take a closer look at as I enter the home or that space in the community, whatever I'm assessing. But is there clutter? I actually had a person with dementia and her daughter. She was living with her daughter at the time when I was evaluating her and working with them. But her daughter was, expressing frustration to me that her mother could not go down the hall and just use the restroom because she still was continent and able to find the bathroom, toilet independently, but she didn't understand why she couldn't locate it. Well, to kind of describe her environment to you, as I was, working my way through her home, she had a long, narrow hallway, and she had boxes that were stacked along each sides of the hallway, which were serving as a barrier for her mom to get through. So I had to educate the caregiver on this and how this was really a barrier. While she had a path to go, there were boxes on each side which were drawing her attention to different places, and it was confusing her mother. And so we worked on adapting that physical space so then her mom could find the bathroom and toilet independently, making it easier on the person with dementia and also the caregivers. So that's an example of a major environmental barrier there. I also have an image of lighting there for you to think about. Dull lighting can be a barrier for sure for people. Again, as we age, we need more lighting, and that's only exacerbated when people have memory challenges. So being mindful of what that lighting looks like in the environment. And then also on the right, you'll see an image of a lady stepping up on the chair. I see this and it makes my heart stop sometimes, where people are trying to reach items in their kitchen that they just have a difficult time reaching standing on the floor. So what do? We adapt, and this creates kind of a makeshift step stool, which you can imagine is a very unsafe way to, retrieve environments on a daily basis. So what do I want to do? I want to go in and I want to try to reduce those falls and those chances of hospitalization. When I enter a case, I always tell my person with memory challenges and their caregivers that this is a shared partnership. We're going to collaborate together, and we're going to figure out what's working, what's not working, and we're going to hopefully kind of bridge that gap, like I had mentioned earlier in the presentation. I also say I want to keep you as safe and as independent as possible as you function in your home environment. So actually, one of the studies that I came across recently that I read involved occupational therapy and home modifications, and it was really alarming. In that study where they pulled specific cases that they were working on home assessment and evals, they ended up recommending on average 15 environmental home modifications to improve safety and function. So that's a lot of recommendations, and that tells me there are a lot of people in our communities that need our help to understand what they need to do to optimize space, safety, and function. We definitely want to be proactive. Prevention is a big area of what I try to do for people that are newly diagnosed with dementia. I also work under a chronic model of care called palliative care. Some of you may or may not be familiar with that, but that model allows me to actually stay in and provide skilled care over time for the chronic disease community. So some of the cases that I've worked on, I've had for up to 5 years. And then also preventing, being ahead of the crisis. That's what I always tell my caregivers. We want to try to be ahead, and we want to be in control. So home assessment is something that I want to think about before we're in a kind of crisis situation. So some guiding principles that I want you to think about today. One being accessibility. So patients with memory challenges have to be able to understand and know where the toilet is located, for example, if they need to use the restroom. So pictures right there, that's an example of something that you can hang on the bathroom door that allows that person to recognize this is where the toilet is located. Second being participation. I want to support people in their ability to participate, again, in the things that they want to do and they love to do on a daily basis. So sometimes it's adapting the way that we do things. Third being to support as much independence as possible for the person with dementia and for their caregivers. I want to support both of them in their home environments. And then fourth, adaptations such as handrails throughout specific places in the home can help to increase safety with transfers in and out of the tub and shower, on and off of the toilet. Here are just a couple of examples. Grab bars are a common item. We're going to talk about that just a little bit, but they also have to be customized to the height of the person with dementia. So it's not just as easy as just hanging a grab bar without any intent or strategy behind it. So there are all different types of home assessments that I can do. One thing that I want to mention before we get into the thick of things here is that home safety assessments done prior to hospital discharge actually have fewer long-term care placements, and I thought that was a very interesting statistic. So here we're going to get into some examples of what I worked on with the case that I started off with Eileen and her husband. One of the first things that I did and added to their environment was a life alert. And this happened, unfortunately, after working about a year on this case. Eileen's husband passed away, and so we had to step back and regroup. As I had mentioned, he was her primary caregiver. So life alert was something that we wanted to get into her home because she was living alone at that time, still in the mild stages of dementia. And she was very capable still of establishing patterns, habit, and routine. So Life Alert was a great choice for us. She had adult children that lived close to her, and this would allow her to alert them and or services if she did experience a fall, and everybody was on the same page to again optimize safety in her home. The second image that you'll see there is that of a dresser modification that we did in her physical space. Eileen was getting a little frustrated because when she was looking at the dresser, she couldn't remember what items were in the drawer, which just increased confusion and agitation. So this is actually a real photo that her daughter took on an adaptation that I had recommended for them, where on the card is just a picture of the item. So if in the top drawer her socks or underwear were located there, that's the image you see with just that text, making it very simple to cue Eileen that that is what was in that drawer versus mindlessly opening and trying to sort and search for things. And that really helped to support her and to be able to dress independently still for some time. Entryways need to be evaluated. I cannot say this enough. You need to think about that point of entrance to the point of exit when you're thinking about the home environment, the community spaces, business spaces, any environment, again, that applies to you and the way that you're kind of thinking about the dementia community. Again, adequate lighting. Is the driveway, the garage, the walkway, all the doors near the trash area? What about the yard? What about after dark? We need 3 times more lighting once we reach the age of 50 years or older, and now take a dementia diagnosis on top of that. And you can see the importance of thinking about lighting. Thinking about the condition of the driveway. Is it smooth? Is it evenly paved? Are there cracks? What does the transition look like between the yard to the driveway? Is there a slope on the driveway? What about during the winter time? Who is going to shovel and remove to make it a safe space for the person with memory challenges to walk through? And then just in general, are walkways smooth to and from the home? Are there handrails to grab onto? And what about the shrubs and the bushes? And, you know, are those things trimmed back so they're not impacting walkways? And then steps leading into the door. Do all of the steps have sturdy, easy to grab cylindrical rails and on both sides, not just one side? Are multiple steps of equal height? And are the stairs tread sturdy? Are they level? Are they in good condition? You know, on the right side, you can see that the lighting, and that's a great strength to that image. And maybe it's more aesthetically pleasing, but there are no rails. It's a tiny step, different heights, different depths, which can make it confusing for someone with memory challenges to safely navigate up and down. So thinking differently, you know, could we add a ramp or something to help to promote, again, the ability to transfer safely in and out of the home and promote that safety? A couple of things to think about. You really need a 5x5 turning radius necessary for a ramp. You have to think about walkers, wheelchairs, not just the person ambulating without an assistive device, because many people do require, you know, something at the very least, perhaps a quad cane or straight cane that they ambulate with. And then, you know, one thing that I make sure to do when I am in the physical space of my individuals with dementia is to not just take their word for the way that they function in that space, but to actually see how they operate in that space. I've learned, I actually learned long ago that when someone says that, yeah, I don't need help with that, I'm independent with the, you know, when all of those things, it actually might be a very unsafe way that they're doing things that I can help to make them understand that there maybe is a safer way. There's an adaptation that we can provide, such as a ramp or railing, that can just make it easier and more accessible. So transferring that concept of lighting into the living room now, as we talk about that space, thinking about a switch to the entrance of the room. Is there an unobstructed path? Are carpets in good condition? Are the plastic runners or carpet protectors tacked down? And do the throw rugs have an anti-skid backing and no upturned corners? I will tell you, I am not a fan of throw rugs. Even if they are tacked down, they just are a fall hazard, and it's difficult for someone with memory challenges to quickly identify a throw rug, lift their walker over, or navigate around. That I really try to discourage the use of those in the home if at all possible. Also thinking about the living room and the chairs in your living room. Do they have armrests? How low do they sit to the ground? I know, pulling back into Eileen here, one of the big changes that we made to the living room once her husband passed was a lift chair. And this supported her ability to independently transfer up and down. We worked on her being able to use the remote, understanding the operations, and how to safely, again, get up and down out of her recliner, which was a big deal for her. And then again, that image on the right, just noting that's a lower chair, there's another throw rug, and it just can be a barrier for people with memory challenges. Now navigating to the kitchen, thinking about, are frequently used items visible? Can people reach them? Are sink faucets easy to reach? And is it easy to determine where the hot versus the cold are? This becomes a safety hazard if people are having a difficult time distinguishing cold versus hot. And so we have, at times I have helped to label with duct tape if people are open to that, bright red color for the hot, dark blue color for the cold, meeting them at where they're, what they're willing and able to do in their home environments. And then also thinking about, are the burners and control knobs clearly labeled, and are they easy to use? Thinking about the sink and the countertop heights. Is there under the counter knee space so someone can sit and maybe chop up some vegetables versus having to stand? This helps to maintain strength, endurance during the task, which can make it safer for someone with memory challenges, again, to engage instead of taking away things, but adapting the way that we do things to support their abilities. And then here's just some imaging for you to think about. Back to that lighting, you can see this is a darker lit area, and how we would want to be mindful of that. Those stools there, really not a good choice for someone with memory challenges, having no armrest, difficult to get up and transfer up and down off of. And then also kind of thinking about what your kitchen tables look like. I will tell you, with Eileen, again, in the case that I've been sharing with you, it was getting difficult to transfer her at a certain point to the kitchen table. And so I had recommended a transport chair for the family, and they used that actually when it was time for her to go in and eat, and they would just push her right up to that kitchen table, and it made it much easier for her to just roll right up and enjoy her meal versus worrying about another transfer to a lower chair. Now we're going to move on into the bathroom and thinking about the sink basin and tub faucets, the shower controls and the drain plugs. Are they manageable? What is the mirror height? Is it appropriate? Again, here you'll see that concept of sitting versus standing. We want to offer choice, or allow that choice to sit, so people can conserve their energy. Can the patient safely step in and out of the shower? In the older homes, you've got, a step over tub. And as an OT, I need to understand, how high can my person with memory challenges actually raise their leg? That's going to tell me a lot, and whether they can safely transfer over into the shower and do that, on a routine basis. What is the height of the toilet? The ability to reach the toilet paper so they can, get clean. Can they flush? Can they come safely from a seated to a standing position? Is the space available? And this was a big one for me, for the caregiver to assist. Again, we cannot forget about the caregiver, and you want to think about these spaces not just for the person with memory challenges, but for their respective caregivers to engage in those environments. And then here's just some images for you to see and think about that pedestal sink, and how, again, I could have the ability to sit under that, versus the image on the left where, yes, I have more ability to store items, but I don't have that. I only have the ability to stand and groom versus seated. And so thinking about those grooming tasks that many of us engage in on a daily basis, when we shave, when we brush our hair, we brush our teeth, what is the accessibility of that space for people with memory challenges and their caregivers? And then these are some things to think about. This is actually from a different case that I worked with. These images here. My caregiver was having a really hard time bathing his wife and getting her to engage in bathing. It was just a difficult situation for many reasons. He lived in an older ranch style home with the heavy sliding doors. And he was having her stand in there, was having a really difficult time reaching her to help with bathing. And it really was becoming a daunting task for both of them. So when I did the home evaluation and the assessment, we really honestly did a total low-cost bathroom makeover utilizing our wonderful senior center here, 50 North, in the Findlay area. I had their chore services department come in. They actually removed those heavy sliding doors. We hung a shower curtain rod, which allowed us to just free up that space for both the person with memory challenges to transfer in, and then also her caregiver to assist. We put an anti-skid mat down. We installed multiple grab bars throughout the shower area. And then we also included a tub bench, which you will see on the right-hand side, which I am a big fan of, because people can actually sit on the very edge of those, undress, and they can scoot their way in safely versus a stool. I've seen makeshift chairs thrown in there. Just some really unsafe situations, which again, if we have the right tools and we're looking at our space in the right ways, we can create a really safe environment, and it can make all the difference for people and to prevent a fall, which is, my number one priority. Then thinking about toileting, our standard toilet height is about 15 inches. So a raised toilet is anywhere from 17 to 19 inches, which is much more doable. And the older homes typically have lower toilet seats. So there are times I will recommend a commode just be placed over the toilet, and you'll see an image there on the right with those armrests. Sometimes we will put that into the bedroom area during nighttime, making it easier for the person if they have a hard time getting to the bathroom in time. This can kind of be peace of mind to just put that in the bedroom area. Again, thinking about your spaces in different ways, not traditionally, yes, of course, the toilet goes in the bathroom, but what is going to work for my person with memory challenges and for their caregivers to do both of their jobs and to not make it more stressful and challenging for them to do. So we think of different ways to use this adaptive equipment at times. And then again, just pointing out accessibility of that space of the bathroom environment. Think about your own bathroom. I think about when my family and I like to go out to eat, and, I have a 4-year-old right now, and so I have to take him to the bathroom, and this is no different for many of my caregivers and their husbands or wives. They like to go out to eat too, but I will tell you, there are many cases where I've had to work with them because they just shut down and don't go out to eat anymore because they're worried about their loved one having an accident and being able to go into the bathroom, because not all bathrooms allow both a male and female or have the physical space for someone to go in and help. So what does that accessibility look like in not only our private homes, but those public places? And what can we do to help to support people that need that extra person to help them go to the bathroom safely? In this situation, what I typically recommend is packing a bag, you know, a backpack that has a change of clothes, some wipes, whatever it needs in case, worst case scenario, there is an accident. And maybe when you enter, you know, the area that you're going to, if you're going out to eat, talking to the manager and asking if you can go into a restroom or that space to help with your friend, loved one, or whoever that might be, so you are able to enjoy dining out. And if something happens, you're prepared for it, but you're not taking away that pleasurable task of dining out. And then also thinking about the shower area. And, you know, I don't know if you're familiar with what Medicare will cover or not, but they actually do not cover the cost of adaptive equipment in the bathroom, which still blows my mind as we put people on, you know, slick surfaces as we're bathing. And so this is all out-of-pocket expenses that we're talking about when we're recommending adaptations, for example, to the bathroom and that space. So again, pulling back on our wonderful community partners, I will tell you, 50 North has an adaptive equipment donation area where I will recommend to my caregivers that they utilize this service, because people will donate items and caregivers can go, and if it's available, they can check it out for free as long as they need it. And they can pull in a tub bench, which would have otherwise been over $100 for them to afford out of pocket, which for many people is a heavy ask. And then also, you know, just thinking about can they use a handheld shower, which is what I have here, where someone, if they are bathing now on a tub bench versus a standing shower, this can make all the difference for them to utilize this type of equipment and still be able to engage in bathing and not necessarily have to use a sink side bath yet at this point. Excuse me. Now moving into the bedroom here, what is the height of the bed? Is it accessible? Is there a chair with armrests so the person with memory challenges can sit and get dressed? Can the person with memory challenges turn on and off and access the light? Oftentimes I will recommend just a motion detected light. It's a safe choice for people, because especially at nighttime when it's darker, you need well-lit paths, especially if people are getting up to go to the restroom. Also thinking about if assistive devices are within reach. Are closet doors easy to open? Are items within reach? You know, think about everything you do in your bedroom, from sleeping to dressing to undressing to locating items. Pulling all those open-ended questions that I've posed to you throughout this presentation into that bedroom area. Lighting, again, being a theme example here for you, and then also thinking about a bed rail to increase ease with transfers for the person to get in and out of bed safely. I will say that if the person with memory challenges is in more of the moderate to advanced stages of the disease, Sometimes it's safest to just place the mattress on the floor up against a wall, which again, I've worked with my caregivers to actually hang rails by the mattress that's on the floor to assist with transfers getting, up and down off of the mattress, so the caregiver can safely assist, as well as the person with memory challenges to engage in getting up off of the mattress. So thinking about those handrails in different ways, and just not literally where we use them the most, where we can use them in our environment so people can grab onto and use safely. And then our last couple of slides here that we are going to conclude with today, I want you to think about what and all of the concepts that I've kind of brought forth to your attention. Move it over to a business area, a community area, and think about those 4 key components that I have outlined for you, with accessibility, with participation, with independence, and with safety for both the person with memory challenges and the caregiver. What does your entrance exit look like? Is it accessible from the parking lot to the entrance to the exit? What does that bathroom environment look like? Can that caregiver assist navigating that environment with a piece of adaptive equipment, such as a cane, a walker, or a wheelchair? What does your lighting look like? What is your flooring like? Is there a change in flooring in certain spaces? What could you do to adapt and bring that forward to someone's attention so they understand when they're moving from hardwood to carpet, if that's the case? These are all things that I want you to think about. And what are the barriers when you think about, again, accessibility, participation, independence, and safety? They all are important and have relevance in this very important topic. So what I want you to think about is, if we support our person with dementia in the right ways to meet them where they are at, both cognitively and physically in their abilities, this population is still very, very, very capable of functioning and even thriving in their environment. They just need us to help to support them and to help them figure it out. And we have to draw attention to the fact that if we are able to support them and to support their caregivers, and we are more proactive in the area of home modifications, adaptations, before an emergency type of situation occurs, we can have such great impact on this wonderful population that is among all of us in each and every one of our communities. So I want to thank you today for your attention, and I'm happy to take any questions. I just appreciate you and your time, so thank you.
Thank you so much, Dr. BUDDELMEYER, for a fantastic presentation. We do have a few questions from our audience. The first is, how does an occupational therapist do a home assessment prior to a patient being discharged from the hospital?
That's a great question. So if you ask your physician or social worker, if OT is not involved in the case, you can actually request that an OT home assessment be completed, and the physician can write a script for that. And in some hospitals, at one of the hospitals that I actually worked for quite some time, I worked on inpatient rehab, and it was one of my favorite things that we did. And we would actually go into the home. We would meet the caregiver there if the person was still in-house in the hospital, and we would do a home assessment and then come back into the hospital and discuss that with the person with dementia and their caregivers to help them plan for a safe discharge in that physical space whenever that time was. So you just have to request, and many places can honor that.
Thank you. Similar to that question, someone wanted to know, can someone receive a home evaluation if they're not leaving the hospital or rehab with a physician order?
You can, if you request a physician, if you have a script that says, occupational therapy, home assessment, or eval, that should get you to the right space in order to prompt that service from an OT to go in and do a home evaluation and assessment.
Thank you. Another question, what is the role of an occupational therapist in promoting mobility as well as fall prevention?
Okay, that's a great question too. And, when I think about mobility, it's the ability to move into that environment, from transferring in and out of the car safely. And for my people with memory challenges that I have the privilege of working with, it's no different than other communities. It's me understanding, are they riding in a car? Are they able to get in and out of the car? Do they have a handrail to hold onto? Going into the home and looking at their ability to ambulate safely, independently, and what are those needs? Because sometimes they change, right? If we're talking about a chronic and a progressive illness, in the cases that I've shared with you today, from the time that I started and I'm looking at the mobility of these people before to the middle to the end of my time with them through the years, these needs shift and change. So my role and concern with mobility is meeting them where they're at and making recommendations to support that mobility safely in those environments.
Thank you. Another question, when you were discussing the donation of assistive devices, someone asked, is the place that you mentioned called 50 North, and where is it located?
50 North is our fabulous senior center located here in Hancock County in Findlay, Ohio.
Thank you. Another question, someone shared that they run an organization and have some residents with Down syndrome. They're concerned about the prevalence of Alzheimer's in individuals with Down syndrome. Are there resources for planning home accommodations and memory care for this population?
That's a great question, and that is actually on the rise in the literature that is available. I would say they would be much the same to what we are doing in some regards to people with dementia. Overall, I cannot point you to a specific resource with that other than utilizing the expertise of people that work in dementia care and just transferring this over for people with Down syndrome, because I think there are many strategies, recommendations, and adaptations that could help to support and promote their ability to independently engage in their environments as well.
Thank you. And then our last question for today, someone shared that their loved one is reluctant to make changes in their home. Do you have any recommendations for how to talk to them about it?
Absolutely. That's a great question. Oftentimes when I enter a case, I will tell you the mild stages of dementia are more challenging at times in a way, because people are more resistant to change during that area. So I think establishing trust is so important. And I have found that focusing when people don't want to make changes to their physical space, and I certainly respect and understand that, but when I can really lean into the fact that I want to keep people home, I want to keep them safe and out of the hospital. And these are the ways that the evidence tells me that I can do that, and the ways that I can support you, your loved one, caregivers, everything, that they do over time see that. I also have found that getting them to think differently about the way we use adaptive equipment, which can be really hard for people. But if you want to stay home and you want that ability to age in place, I really try to ask that they trust, and maybe we start to make small shifts and changes and take a little bit at a time to make those recommendations. And then they're able to see, wow, this really made a difference. And then they're more open to future changes. So I would recommend, again, leaning into keeping them home safe and independent, and also recommending small changes at first and working towards those bigger changes that can have heavier impact.
Thank you so much. That does conclude our questions. I want to thank Dr. BUDDELMEYER again for your fantastic presentation and all of you for your great questions. Before I conclude today's webinar, I would like to tell you briefly about BRI Care Consultation, a care coaching program available for families impacted by dementia in Cuyahoga, Athens, and Washington Counties in Ohio through the Administration for Community Living funded project. BRI Care Consultation is a telephone and email-based care coaching program that assists and supports both adults with or at risk of developing dementia, including those with intellectual and developmental disabilities, and their family and friend caregivers or other supports. So through this Administration for Community Living funded project, we are able to offer this program at no cost to you and your family. Next slide, please. So care consultants work with families to find and connect them to health and community services in their areas, to prioritize concerns using simple action steps and a plan that really is focused on your needs. They communicate with loved ones, family, and friends about care and help to manage difficult situations and behaviors. They really stay in touch with individuals and families so that adjustments can be made as situations change in your care situation. They assist you with getting other family and friends involved in your loved one's care. And they're there for you as an emotional support when feeling overwhelmed or faced with new challenges. Next slide, please. So this slide does show our partners in delivering this program through this project. In Athens County, we have United Seniors of Athens County delivering this program. In Cuyahoga County, we have Welcome House and Benjamin Rose under the name of We Care Because You Do. And in Washington County, we have O'Neill Center. Underneath those logos, you will see phone numbers that you are welcome to call to enroll in this free program. Anywhere where you see a star, they are serving both individuals with dementia as well as those living with intellectual and developmental disabilities or who are at risk of developing dementia. Next slide, please. And that concludes our BRI Care Consultation portion of today's presentation. If you have any questions about BRI Care Consultation, please feel free to contact any of those phone numbers that you saw on your screen. We want to thank you again for joining us for Maximizing the Environment for Individuals with Dementia. A recording of today's session will be made available at www.benrose.org on the event registration page and in our resource library. We are offering more webinars like this for community organizations and for families impacted by dementia each project quarter of this ACL grant. We hope you'll join us for our upcoming Family Caregiver webinar on December 1st, titled Dementia, Using GEMS to Uncover Clarity. To stay up to date about our upcoming webinars, please visit our website, www.benrose.org. In the chat, you will see a link to a post-session questionnaire. You will also be receiving it via email later today. We ask that you please complete the post-session questionnaire within 1 week following today's session. Your responses and feedback will be used to show the impact of programs like these and to improve the tools and resources provided to individuals living with dementia and the people who support them. Thank you again for joining us, and I hope you all have a great rest of your day.